as thank you. Thank you for joining us this morning. We're glad to have you for this information session on prenatal to 3 family strengthening information. My name is Sarah Brown. I'm the president of Health Systems and Family Resilience at First 5 Orange County. I am joined this morning by many of my colleagues, so I'd like them to introduce themselves now. I will pass it to Anaya first.
Hi, everyone. I am a program officer at First 5 Orange County, and I'm also on the Health System Family Resilience team. And next, I will pass it to Yvette.
Good morning, everyone. Yvette Nunez, program officer as well with First 5 Orange County. Happy to be here, and I'll pass it on to Andrew.
Hi, I'm Andrew Montejo, data analyst at First 5, and I'll go to Kim.
I'm Kim Gall, CEO with First 5, and I'll pass it to Nilla.
Hi, Anila Neumeister. I am a consultant with First 5. And I think that's all of us. Oh, Rhonda.
Hi, I'm Rhonda Sarah. I'm an executive assistant over at First 5.
Thanks so much, everyone. So as we move forward with this presentation today, we will start with some housekeeping specific to the use of the webinar, followed by some background of the RFI and First 5's decision to move in this direction. And then we'll move forward with an overview of the RFI document itself, and we will conclude the call with expected next steps. So in this slide here, we can see we have a few housekeeping points we just wanted to go through at the beginning of the session here. We're using a webinar format today, so it's a little bit different than a traditional Zoom interaction. We would ask that you please use the question and answer feature. It's listed as Q&A to pose any questions that you may have for the panelists. The chat has been disabled for this session, and while we may not be able to get to all of the questions today, we have someone that is collating and recording all questions as they are submitted, and they will be addressed in the frequently asked questions section, which will be posted on the First 5 website no later than February 24th. After this webinar ends, you will also have the opportunity to continue to engage and submit questions via email. These will need to be sent to First 5 no later than February 17th, so they can be added to the frequently asked questions section on our website. And lastly, as you've heard, this session will be recorded, and we will also post the recording to make that available for you on the First 5 website. Next slide, please. So we wanted to bring this up in our session today, and many of you are probably aware, and some of you might not be as aware, but First 5 Orange County has been a long-term investor and system supporter of home visiting and other prenatal and postnatal strategies for both prevention and early intervention throughout Orange County. Over the last year, we've been actively working with county partners to improve the system outcomes, and a recent landscape analysis has shown us a gap in the number of families in Orange County who would likely benefit from these types of services. Additionally, the growing recognition of home visiting as a validated and evidence-based approach by new funding streams is also an additional support to First 5's intentions. And as you've noticed, there will be some links that are being dropped throughout the session here too to support the content we're going through. Next slide, please. So due to the findings that were just addressed in the previous slide, First 5 Orange County is seeking responses to a request for information, which will be referred to as the RFI, from organizations to gain a better understanding of services that currently exist around home visiting and other prenatal and postnatal services. So this RFI really is an information gathering tool to help us understand the prenatal to 3 landscape in Orange County. We're looking for programs that are both evidence-based and non-evidence-based, that are grounded in resources that strengthen family and early relational health. The utilization for this RFI really places an emphasis on learning from the community and provides organizations with the opportunity to acknowledge their strengths, unique roles, readiness, and interest in meeting community needs that target birthing people and families with children ages 0 to 3. So even if your organization does not currently provide these services, We would like to know your interest level to gain a better understanding of the distinctive role your agency plays. Particularly in any roles that you have in serving under-resourced populations. And I would like to reiterate our overall message, which is just that any submission is valued. We value all submissions. Any information that you're willing to share is absolutely valued. First Five does anticipate moving into or being able to use this information to move into some contractual agreements, but we will also use this information for future planning and planning with our other community partners. I will pass this off now to my colleague Yvette. She will move through the RFI document and further submission logistics.
Yes, thank you so much, Sarah. And thank you for all of you that are joining us today. I know that maybe some of you are following along with the RFI document itself. So if you are, I'm currently looking at page 4 where we're looking at the RFI response. As you can see here, it's outlined that organizations do have the opportunity to submit responses as standalone organizations or as a collaborative. The unique thing also is that we do have options provided. This allows you as an organization to review your readiness to start delivering services and look at where you fall in the lineup of continuum of being able to provide services. So that option could be that you're ready to provide evidence-based home visiting programming as soon as July 1st, or that you need training in some sort of evidence-based home visiting program. You could fall into the category that perhaps you're interested in evidence-based home visiting program training and you need additional resources, or perhaps you're just learning and curious about home visiting and wanting to have that conversation. So it really lends itself for you to be able to reflect and examine where you are as an organization and be able to select one of those options. So next I'll go into the submittal requirements. And so as we go here, I'm looking particularly on the page 5, which says submittal packet. And we'll start with the cover letter. So we want to ensure that we're going over the details in case you haven't had a chance to actually review the RFI document in full. This really gives you a great overview. So if we start with the cover letter, we're noticing that we are going to require that you have the organization's name, that lead person and contact, as well as a signature of the corporate officer. Keep in mind, we really want you to pay attention to response formatting so that information is detailed under every single section. So pay close attention to specifications, guidelines, fonts that'll help guide you when you're formulating your responses. And then something that we definitely want to remind everyone is the way that we will be receiving your submittals will only be through an electronic process. So keeping in mind that we will need for you to convert your Word document into a PDF format, and it does need to be emailed to First Five. And so I believe one of my colleagues will be dropping that email in the chat for you so that you have that readily available. And we do encourage everyone to keep track of time. We would hate for any technical glitches to occur if you're trying to submit, when it comes down to the wire at 2:59. So the earlier you could start on getting the paperwork and getting all of that process together, the better that it'll be. So a reminder that those responses will be accepted up until Friday, March 3rd at 3 p.m. Moving along, we do want you to notice that we did include attachments in this RFI document. And really the purpose around the attachments is to be able to allow you to have that conversation and tell that story. So you'll notice that we have tables and then we also have narratives. So really the tables and the narratives allow you to kind of concise and bring together your information in an organized manner and for you to be able to share important highlights about the program. So both the tables and the narratives are required for consideration. And as my colleague Sarah mentioned, I just want to echo First Five welcomes all of the information that is submitted. So whether it is a substantial amount of information or you have a curiosity and you've begun to really look at some of these prenatal to 3 services, you can definitely submit it and we will be glad to review it. If one of the particular columns are you finding that you don't have an answer for, we would definitely encourage you to put NA if that question or that column is not applicable to some of the workers that or services that your organization is providing. So next I'll look at table 1, which what you could see is really focused on program and services. Again, just to bring your attention, there is a 50-word response limit. So this is again where I was mentioning that we have put prompts in there to kind of guide your responses. And so that is definitely something that I would draw your attention to when you're formulating your responses. So in here, we're looking at things such as program description, the number of families that are currently enrolled, the referral services, summaries intended, like your impact summary of how your program is impacting the target population that you're working with, any links or websites or pamphlets that can potentially help us to further our understanding. And then additional comments. So this is a great place for you to provide additional information that you think might be useful for us to know and how it relates to your particular program or organization. This is the narrative. And again, the narrative is a way for you to add and to enhance some of the information that you've mentioned in the table. So this first narrative focused again on program and services, and we have that 500-word limit per response, and so per question. So looking at these questions, we're really looking at some of the strengths in services that you have, that your organization has around early relational health. We're looking at some of the ways that you are conducting outreach and engagement, and how this is used to then report and provide services to families. We're also going to be looking at if your organization is currently not providing an evidence-based home visiting service, but maybe you're interested in which particular evidence-based service are you looking at, or model are you looking at for children 0 to 3, and an explanation as to why that might be. And then lastly, we have additional services. So maybe you're not providing home visiting, but again, we definitely want to explore that prenatal to 3 landscape and welcome all of the different services. So that could be a father engagement group, a developmental play group, or some sort of unique service that is specifically targeting that prenatal to 3 sector. And then any other information that you'd like to share with us, you're able to do that in this narrative. On page, this is going on to now page 3 of the attachments. We're looking at another table which is focused more on the staffing and funding capacity. So we definitely do know that, you know, some of you might be in that planning stage. So really, this is an opportunity for you to provide us that glimpse of what could your number of FTEs look like, the staff to client ratio, the language capacity that you currently have, or that you think you might be able to have that funding source. And then also looking at a budget. So we understand that you might not have that detailed budget, but maybe having that big picture budget of what that would look like, what it would look like for staffing or indirect staffing. And then also different situations that, you know, you might be having. And so we would also encourage you that if you don't have maybe the answers, or you're looking to potentially grow your program, that you can definitely use that additional column, the additional comments column, as a way to say, currently my program is in this area or this particular budget. However, I would like to grow it to, you know, X budget. So we definitely use that. And again, keeping in mind the limit for each of those responses. The next narrative is again focused on the capacity and staffing scenarios. We're going to go into a little bit more of the scenarios of what your organization or team currently does if there is a wait list. So what are those wait list protocols that you're able to link families to services in a quick manner, and you're able to connect with them, looking at some of the engagement and the collaboration with key stakeholders such as parents, nonprofits, and then other governmental agencies. We'd also like to know a little bit more about what kind of collaboratives you're involved in. So as my colleague mentioned earlier, are you part of the Home Visiting Collaborative? Is there participation in OCB Well, in different groups that we have here in the county? And then how you use to leverage funding, and then a plan for ongoing sustainability and ongoing service provision. So anything that you could provide on that, we would definitely like to review. And then any other information that you think, you know, relates to state funding or capacity for the program or for your agency overall. And then this last table is going to be looking primarily at demographics and population. So looking at what is your target population, looking at demographic breakdowns by participation, by participants, and then any special population served. So if there are particular special populations that you're currently doing outreach to, any particular geographic coverage, and then linkages to other resources. So is your service or program able to then link families to particular resources? Is there particular partnership with other community resources? And then utilizing that additional column section to add additional information that you think might be pertinent or relevant to the information that you are sharing with us. And then lastly, we have this narrative that again is really focused on your agency's experience. So looking at the experience that you have at serving historically marginalized populations and looking at the focus that you have with such families with such disorders or any kind of involvement in the child welfare system, anything that your agency is particularly focused on, and how your agency tailors messaging for these different populations that it serves. And so we would definitely like and welcome that information. So at this point, I'm going to go ahead and just pause here because I know that that was a lot of information and we wanted to take you through the different narratives and the different tables.
I can respond to, it looks like we have a question in the chat too. And thank you for this question. This is a great question. I'm sure others will have as well. If there are any sections that don't seem to fit you in one way or another, please just tell us that. You know, you can put NA in a section and then use the narrative or the tables to further expand on what it is you're interested in doing or where your capacity is or where your experience lies. So I hope that answers, but yes, thank you. If there's a section that doesn't fit you exactly, we recognize that, and please just note that and use the other sections to expand on the information you want to provide to us.
Thank you, Yvette and Sarah, for giving us further background into the RFI and just clarifying what the document entails. Hi, everyone. Again, I'm Anaya Brown, a program officer at First 50C, and I'll be taking over. So we have a few more slides left. Thank you for taking the time to be here with us today. So in terms of evidence-based models, we compiled a list of evidence-based models that have potentially different funding streams, and you can see them in attachment number 2. But just please keep in mind that this is not an exhaustive list of all evidence-based models. However, we wanted to provide the list more as a point of reference for applicants that may potentially be interested in exploring an evidence-based model. So now we have next steps. Next, please visit the First 5 website to download the RFI. And if you look, there should be a link in the chat. And if you have any questions, please submit them to the email by February 17th, 3 p.m. The questions and answers will be posted to the website by February 24th, close of business. And just an FYI, FAQ stands for frequently asked questions, and it will be a summary of the questions asked during the webinar. Submit RFI responses by March 3rd, 3 p.m., but an emphasis on please try for 2:30 p.m. Post-submittal, we may reach out to some organizations if we have clarifying questions or anything of the sort, so please make sure to check your emails for correspondence from us. So we appreciate you attending and value your time. First 5 would like to remind everyone your submission is valued. If you need to log off, we understand. However, if you still have questions and can stay on, we can collect your questions and make sure to include them in our frequently asked questions that will be posted on the website on February 24th.
And I think there's another question here in the chat. So thank you again for these questions. And we, as a reminder, we'll collate all of these and respond to them again to be posted on our website. But the question specific to tailoring messages, we're really interested more so in your particular outreach and specifically to historically marginalized or under-resourced populations and communities. So I'm not sure that I have a specific example right now, but any mechanisms, intentions you have around that area, we would be interested in and love to know about. Let's see. I think the budgeting questions, again, Yvette focused on this a little bit, but please share what you can with what you know now. We know that there are probably questions that will arise that are dependent on other variables that we don't know at this time, but please share with us what you can. And in general, we're not asking, it's a little different than, I guess, a traditional RFP where we're not asking for an itemized budget at this point, but in general, the resources you would need to support the programs you're interested in or the services you're interested in. Anila, do you want to comment on the limit for 50 words per cell or per row?
Sorry, I had a hard time unmuting. Yeah, so the limit for the table and for the narrative is for you to just be able to be succinct in your responses while giving us the information that you think that we need to know. We do ask for limits to make it easier as the team is going through the responses, as well as to make it easier for you so that you're not having to compile a lot of different information. So as succinct as you can to get within that limitation. Of course, if you go over by a bit, we're not going to be like dinging you or anything like that.
Thank you, Noah. That was great. And just to add to that too, we do have those narrative sections where you can add a bit more if you felt like you weren't able to include it in the table format. The question specific to counties, yes, we are interested in Orange County. Our funds are utilized for the 0 to 5 population. In this work, we're even more interested in the 0 to 3 specific to Orange County.
Anil, if I could just raise again, the 50-word limit, is that per cell? Is that a suggested limit or a hard limit?
It is a suggested limit and it's per cell. So in each of the columns where you have a little window to write what you'd like, it's 50 words there. Again, it's a suggestion. We say require because of course we don't want people to go on, and of course they're tables, so they're difficult to read anyway. So just keep that in mind. But again, 50 words per cell.
As far as the in-kind matching, I think anything that you're open to sharing is helpful. That is part of our purpose in doing this, is not just to have siloed information. We do want to share with our county partners. And as we mentioned at the beginning of the session, there's several different funding streams that have also now recognized and noticed the value of home visiting specifically. So that is our intention, is to work in partnership with others for sustainable strategies. So I think if you're open to sharing that, that will be helpful information. The asterisks on the EVP list, thank you for asking. It was really, that's more of an internal piece for us. We are focused on this particular outreach around 0 to 3. Our funding is specific to 0 to 5. And some of the programs that have been listed for other funding streams include age groups outside of 0 to 5. So it was just more of an internal note for ourselves as we sift through information.
Sarah, would you like me to take the funding level one?
That'd be great. Thank you.
So there's a question in the chat. What are the first 5 OC state and federal award levels in terms of the contract, 1 or 3 years? At this point, I would answer that as we're not sure. The intent of this is to gather information So I cannot give any specificity as to this. We will be reviewing what we received with our commission in April. We have historically done 3-year agreements to create continuity and stable funding for a time period. That's been First Five's philosophy in the way that we've done our work. I'm not sure whether we'll depart or not. That is a commissioner-driven decision. In terms of the state or federal awards, we're not controlling those state or federal awards, so we have no governance over them. But what we will be doing, as Sarah's mentioned a couple of times, is sharing the information that we have and our plans with our local county partners to try and, again, create a systems perspective on investments that are made.
And then I think there might be a question. Let's see. Sorry, I'm trying to get through. Yes, definitely. We're open, again, to evidence-based practices and non-evidence-based practices, evidence-supported practices. We are open to all information. That's all very helpful in understanding this larger landscape for Orange County, and to Kim's point, shared resources with partners. So the question about receiving responses, thank you for this. I think Yvette mentioned briefly, there is the possibility that we could be reaching out for more information. So that could look like a phone call, a Zoom meeting, something like that, if there's the need for more information and to better understand the wants and desires. This information, this collection of information does allow us to move into contracting, and we do intend to obviously support ongoing services that are already in place. But we also really want to use this information for future plans and development. Again, back to the same idea that we know there are other funding streams coming down very much so in line with the same timing of this, that will likely support some of these mechanisms too. So to do that in partnership. Confirmation email, we can definitely do that. We can send a confirmation email upon receiving submission. Our team can go back and determine how we can best do that, but yes, we can do that. And again, just as a reminder, we are collating all of these questions, and we'll be posting them again. So this is not the last time, and you'll have the opportunity to continue to email questions, which we will also post, and the recording will be posted as well. Thank you. We appreciate everyone being on today. And again, we still have a few minutes, so we're happy to stay on if there's more questions that come in. It looks like they've slowed a little bit in the chat box, but we are happy to stay on for a few more moments. And we truly appreciate everyone's time today. We know you're busy. So thank you for joining us, and thank you for being a partner in this process. Thank you all for joining as well, just seeing these notes. Thank you so much. Table 3. Yvette, do you want to respond to table 3?
So yeah, so for table 3, we're looking at like special populations. So it might be that your organization is currently working with maybe refugee population, or maybe they're working with maybe teen parents. And so if that's a special population that you have tailored messaging or tailored outreach, you can definitely include that in the description or additional comments. And by no means are we saying that our definition of special population has to match yours. I think it really allows, again, this is a learning tool, and so we're welcoming the responses that you provide, and those additional comment columns are there for that reason. So hopefully that helped to provide a response.
Thank you, Yvette. And I see there's a question about joining late. Yes, this session has been recorded and we will be posting it on our website, the First Five website. So I think, yes, you can use the tables to include that information, but there is also that narrative section that we've included. So if you feel like you were not able to provide the information you wanted in the table, that's an additional area where you can provide information. As far as the I guess recommended ideas we have about the font and size and that kind of thing, those were just recommendations to sort of keep the information that's received similar. So for the reviewers, they have something similar to review. Again, I think Kim had probably mentioned earlier, someone on our call mentioned earlier, it's not something that would be negative against you by any means, but just what we put out as some examples we'd like you to try and adhere to as best you can. So yes, this is a great question about sustainability. As most of you probably know, this is something that's very important and sometimes can be overlooked with new funding opportunities. So yes, that is our intention, is that we really work in partnership with our other county partners to understand how we can best support these programs and meet the needs of our families in our community. But yes, to your point, understanding sustainability is important. And so that's why we've been intentional about, for example, some of the home visiting programs that we've listed are specific because they are already currently identified or proposed to be identified by other funding streams that will enable stronger sustainability platforms.
If I could, Sarah, I want to add a little bit on that.
Thank you.
So what we're looking for the sustainability stuff is not necessarily the standard answer of like, we're going to fundraise for it. While that's important and interesting, it's more about, have you given any thought to where you might think long-term funding might come from this program? Or are you already receiving sort of ongoing governmental based service contracts, which help you sustain the program? Just so that we can have an insight again, as we start to think about community planning and sharing the information with our partners. So there's both the prospective idea about the additional funding streams and what we know is coming down from the state or the federal government to expand home visiting models, but there's also stuff that you might already have a sustainable funding source or something that limits the impact, the size of your program, but is a continued funding source for you. So both information would be helpful. We're less interested in we're going to fundraise for it. We know that all of you work really, really hard to fundraise. You're all nonprofits, all doing great work. It's more that if you have a vision or an eye towards what long-term sustainability could look like, that's more guaranteed. I guess that's kind of a weird word to use, but on ongoing, regular, incremental amounts of funding, that would be helpful for us to know.
Thank you again for joining us this morning. It looks like, again, I guess last time I said this, they popped up again. It looks like the chat is slowing, but again, we can be flexible and stay on if there's continued questions. But we also understand your time is valuable. If you need to log off, we will record this and post the session.
I know we've said it, but can we repeat? If someone gets off this webinar and then decides they have a question, they can submit that question to our email address that's in the chat. And they have until what day to submit questions? Anybody?
They have until next Friday. So if we can have all of those questions submitted. So that's next Friday, February 17th before 3 p.m. And we will collate all of that, those questions received via the email, as well as the questions that were collated and recorded during this webinar, and they will be made available on Friday, February 24th on the First Five website. And also, if it wasn't mentioned, we will be sending out weekly communication via our constant contact email that'll have information to remind you of these and these deadlines, I guess, so to say, and just to remind you, get your questions in, submit your response, because we all know that we're all really busy, but we want to make sure that we give the community an opportunity to share all the great work that's being done around the prenatal to 3 landscape.
And it looks like we had one more question come in. Yes, if you can put it in one combined document or PDF, that is preferred.
Great questions.
Okay, I think we will wrap up this information session. Thank you again for joining us. We appreciate your time and your valued partnership in this learning effort. And again, you'll have additional time to continue to email questions. We will post everything on the First Five website, and we look forward to continuing to be a community partner with you all.